Is now starting. All attendees are in listen-only mode.
Good afternoon. My name is Stacy Subita. This is the Department of Family and Support Services Respite Services RFP webinar. If you could go to the next slide, please. So a little bit of housekeeping for today. Due to the volume of participants, everyone has been placed on mute. Please submit any questions via the question box, and we will respond to your questions after going through our slides. And then please use the question box as well to notify us if there are any technical difficulties. Next slide, please. So the agenda for today, we are going to go over our introductions, the purpose of this RFP, the background, the program model for respite services, selection criteria, timeline, technical assistance for applicants and e-procurement, and then we will save a portion of the presentation for questions. Next slide, please. My name is Stacy Subita. I am Supervisor of Family and Support Services with the Caregiver portfolio. With me today, I have our Community Living Specialist, Jatina Givens, as well as Julia Talbot, who is the Senior Policy Analyst for DFSS. Next slide, please. And I'll hand it over to Jatina. Thank you.
Thank you, Stacy. Good afternoon, everyone. The Chicago Department of Family and Support Services is made up of 7 different program divisions, and those divisions are Children's Services, Domestic Violence, Homeless Services, Human Services, Workforce Services, Youth Services, and today's RFP is brought to you by the Senior Services Division. Next slide, please. DFS mission and priorities. Our mission is working with community partners. We connect Chicago residents and families to resources that build stability, support their well-being, and empower them to thrive. Our priorities include deliver and support high-quality, innovative, and comprehensive services that empower clients to thrive. We collaborate with community partners, sister agencies, and public officials on programs and policies that improve Chicagoans' lives and advance systemic change. We inform the public of resources available to them through DFSS and its community partners. We also steward DFS's resources responsibly and effectively. Next slide, please. The purpose of this RFP is DFSS seeks to procure a delegate agency to manage a comprehensive program, including outreach, conducting comprehensive assessments, creating person-centered plans of respite care, and administering the care plans by securing the most appropriate in-home and residential respite providers for the person being cared for by the caregiver. Next slide, please. Just to give you a little background about DFSS, the Senior Services Division is designated as the local area agency on aging, also known as the AAA, for the city of Chicago. As the AAA, DFSS coordinates and funds services for older adults, prioritizing those in greatest economic and social need, those who live alone, and those at risk for institutional placement. Working in collaboration with agency network partners, the Senior Services Division's efforts are guided by supporting older persons to live independently in their own communities and homes for as long as possible, ensuring that those who reside in institutions are treated with dignity and care, and also guaranteeing that older persons have access to accurate information to participate in public policy. Together with our service providers, we provide vital information and assistance, also known as Information and Assistance, INA, congregate and home delivered meal services, senior centers, fitness classes, caregiver support services, in-home services, employment, training, and volunteer opportunities, elder rights programs, health promotion, and access to benefits. We continually advocate for our residents so they may continue to thrive as they age in place. We value integrity and respect, as well as promoting social engagement among the elderly as an antidote to dependence, social isolation, and withdrawal. Next slide, please. The goals of this RFP, of the Caregiver Respite Services RFP, is to provide caregivers a temporary break from caregiving to alleviate caregiver stress and social isolation, improve the caregiver's health and wellness, increase caregivers' confidence to continue to provide care for the care recipient at home, and to delay premature institutional placement of the care recipient. Next slide, please. The target population and eligibility include an informal or unpaid individual, adult family member or friend of any age, providing care to an older adult, 60 years of age or older, or a care recipient with Alzheimer's disease or a related disorder with neurological and organic brain condition, ages 18 to 59 years old. They must live within the city of Chicago. There are no requirements as to the duration of residence or citizenship will be imposed as a condition of participation. Participants prioritized per the Older Americans Act, Title III, include persons who are frail, who have the greatest economic or social needs, who have limited English proficiency, who are low income, and who are minority. Next slide, please. Racial equity and non-discrimination. According to the Government Alliance on Racial Equity, also known as GARE, racial equity means that we no longer see disparities based on race, and we improve results for all groups. We no longer focus on outcome disparities that are the result of inequality, but actively work to dismantle institutional and systemic racialized systems that are costly and depresses opportunities for us all. The City of Chicago commits to reducing disparities based on race, color, national origin, age, gender, sexual orientation, religion, disability, and other potential discriminating factors for citizens. DFSS Senior Services serves a diverse population of older adults and their families. Selected respondents must collect demographic data for DFSS to continue monitoring how Chicago citizens are best served. As per the Older Americans Act, data collected must include age. Client disclosures of race and gender are desired but voluntary. Next slide, please. Program requirements, Caregiver Respite Services. The selected respondent will be responsible for the program management, including outreach, administering a comprehensive assessment, a selection process for service providers, determining how to match respite clients to selected providers, as well as evaluation and program impact on caregivers served. The respondent should aim to serve 100 unduplicated care recipient/caregiver pair for each fiscal year citywide. Next slide, please. Program requirements continue. Selective respondents are expected to incorporate best practice and evidence-based standards in implementing caregiver respite services, develop a thorough outreach plan to identify eligible caregivers for the program, conduct the assessment, coordinate, and schedule services based on 3 priority levels: emergency, urgent, or standard. Develop a list of providers and process for inclusion on the list for both in-home respite as well as facility-based respite. Next slide, please. In-home respite provides general non-medical support by home care providers to maintain the safety and daily activities of older adults in their home. In-home respite services must provide respite services 7 days a week, 24 hours per day, including holidays. Ensure that no client household receives more than 100 hours of service per fiscal year. Ensure that staff have undergone an FBI, state and sex offender background check, adult protective services registry check, and do not have a criminal record. Have written policies and procedures to ensure all clients' property is treated with care and respect by all staff. Have access to staff or telephone or computer-based translation services with language skills that reflect the needs of the client household served. Next slide, please. In-home respite activities may include assistance with activities of daily living, also known as ADLSs, including bathing, toileting, dressing, cleaning teeth, and or dentures. Bathing may include preparing supplies and monitoring of non-medical personal care tasks, such as shaving, shampooing, combing, assistance with sponge bath, standby assistance with tub bath or shower when clients are able to enter and exit themselves. Assistant with instrumental activities of daily living, also known as IADLSs, including meal preparation, cooking, shopping, and cleaning. Communication and social activities, including spending time with care receiver, in addition to providing care as needed. Talking, reminiscing, individual or group activities, and outings to places in the community, such as shopping, museums, parks, libraries, senior centers, etc. Monitoring the senior client's well-being and reporting to caregiver and care manager any problems, concerns, and successes. Next slide, please. Facility-based respite is when the senior client is temporarily placed by the caregiver in an institutional setting, such as a nursing home, assisted living, or supportive living facility for a short period of time. Facility-based respite services must provide respite services 7 days a week, 24 hours a day, including holidays. Ensure that no client household receives more than 240 hours or 10 days of service per fiscal year. Ensure that staff have undergone an FBI, state and sex offender background check, adult protective services registry check, and do not have a criminal record. Ensure facility-based respite sites are licensed by the Illinois Department of Health Care and Family Services, also known as IDHFS. A list of the facility-based respite sites and a copy of facility licenses should be submitted with the RFP proposal package. Have access to staff with language capacities that reflect the demographics of the client household being served. Next slide, please. Facility-based respite activities may include ADLSs, including bathing, groups, toileting, dressing, cleaning teeth, and or dentures. Bathing may include preparing supplies and monitoring of non-medical personal care tasks, such as shaving, shampooing, combing, assistance with sponge bath, standby assistance with tub bath or shower when clients are able to enter and exit themselves. IADLS, including meal preparation, cooking, shopping, cleaning. Monitoring the senior client well-being and reporting to caregiver and care manager any problems, concerns, and successes. And now I will turn it back over to my colleague, Stacy Sabita.
Thank you, Jatina. So the next section will review costs and rates. So the selected respondent will be responsible for paying the provider for the costs of care for recipients and then invoicing DFSS. The caregiver respite provider is then reimbursed by DFSS. The reimbursement rates for both in-home and facility-based respite are as follows. So for in-home services providers, we are reimbursing at a maximum of $25 per hour or a $2,500 limit per fiscal year per client. For facility-based, we are going to be reimbursing at maximum $200 per 24-hour day for a total of 10 days of service, or $2,000 maximum per fiscal year per client. In this RFP, we have also included the option of combination of services, so both in-home and facility-based, with a max of $2,500 per fiscal year per client. Next slide, please. So as far as units of service, a unit of in-home service respite is defined as 1 hour of the respite worker's time spent expended on behalf of the direct care or supervision of the older adult. The city will not reimburse for travel time to and from a client's home. For facility-based respite, a unit of service is 1 24-hour period. The selected respondent who may have to prepare and report and grant applications, these activities are considered administrative responsibilities and are not a billable activity directly on behalf of a client. Next slide, please. Given what has happened over the past year with the pandemic, we are putting special emphasis on development of contingency plans for any emergency situations that require a change in programming, registration, location, and times. This can include, but is not limited to, the pandemic, but also any weather emergencies such as winter storms, tornadoes, or heat waves. It may be necessary to transition some in-person interventions to other delivery methods if and when local officials deem in-person programs unsafe. Other methods should remain in place until local officials deem that in-person programs are safe again. So for example, some of the assessments have been transitioned into telephonic or virtual during the pandemic. The selected respondent should develop policies and procedures to include sections on training, PPE, health screenings, temperature checks, and contact tracing. Policies and procedures must be in accordance with the CDC, the Centers for Disease Control, IDPH, the Illinois Department of Public Health, and FEMA, the Federal Emergency Management Guidance. Next slide, please. As far as staff qualifications and requirements, the respondent is required to assign and maintain for the duration of services staff who are of qualified personnel to perform the services. The selected respondent will retain and make available to the city, state, and federal agencies governing funds provided under this agreement proof of certification or expertise, including but not limited to license, resumes, and job descriptions of staff. Next slide, please. The staffing pattern must include appropriate management and supervisory and support staff to conduct the assessment services and arrange respite providers for the family caregivers receiving Title III services. So there is a program coordinator or director role, which serves as the key contact for DFSS, who manages the program operations and oversees the list of providers, arranges and has overall accountability for the service, and this role may not be vacant at any time during the contract period. We also included an assessment and placement coordinator who conducts the comprehensive assessments of the caregiver and care receiver and determines placement with the respite providers. The service provider must have a valid business license to operate in Illinois. They shall continue services regardless of staff turnover. Staff training must be provided and supervision to in-home respite workers. And there should be maintenance of an in-home respite worker schedule and/or timesheets as documentation of actual service provision. Next slide, please. Again, the respondent will have to comply to all applicable background checks. So federal, state, local laws, ordinances, policies, procedures, regulations, rules, and requirements. That includes fingerprinting and screening procedures to ensure the client's safety. Adults 18 or older, whether they are staff, volunteers, consultants, subcontractors, operators, or individuals used to replace or supplement staff, And if they have direct or indirect contact with the older adult, they will also need to complete this background check. Delegate agencies are required to administer the following types of checks: a fingerprint criminal background check that searches both FBI and state databases, a search of the Illinois Sex Offender Registry, a search of the Adult Protective Services Registry, and the bottom about the child abuse and neglect tracking system, that is for our delegates that work with children under the age of 18. Delegate agencies also need to have written policies on their background checks, as well as they have the affirmative duty to report any incidents to us in a timely manner. Next slide, please. To track progress toward achieving the outcome goals of this program and to assess success, we will be monitoring a set of performance goals and performance indicators that include but are not limited to 80% of caregivers indicate reduced stress and social isolation. 80% of caregivers report that they are able to continue to provide care for the care recipient. 80% of clients surveyed indicate overall satisfaction with the services provided, and 100% of the emergency referrals are responded to within the designated time frame. Next slide, please. To monitor and recognize the progress towards these performance indicators, we will be tracking output metrics that include 100 clients and 5,512 units of individual home care respite and/or facility-based respite on an annual basis. In addition to the performance indicators and output metrics listed above, we encourage respondents to propose additional indicators and metrics, including those that demonstrate early success and are indicative of the participants' progress. Next slide, please. As part of contract management and data reporting requirements, we also require that the respondent have client files. They must maintain these files in a confidentiality. They must keep these files in a secure, locked space. They can also elect to keep case notes and files electronically. There also must be a process for client complaints and grievances. So there must be a mechanism for this with regards to the provider service delivery. Clients must also be given a mechanism for comments and suggestions on service delivery improvements. Another part will be program evaluation and satisfaction surveys. The selected respondent must have procedures for evaluating and reporting the caregiver's satisfaction with the delivery of service, as well as their satisfaction with the outcomes of the service. Finally, reports, invoices, and meetings. The selected respondent will need to use a computerized client tracking system to provide required data and reports to senior services on a monthly basis. DFSS requires that providers have a program and fiscal reporting system that will ensure the provision of accurate and timely reports. Quarterly meetings, or as otherwise scheduled, will be held with the agency to discuss program operations and progress. Next slide, please. So the anticipated term of contract will begin October 1st of 2021 through September 30th of 2023. So this is a 2-year contract. Based on need, availability of funds, and contractor performance, DFSS may extend this term for up to 1 year. We anticipate awarding one contract for up to $293,333 annually. This contract will operate on a reimbursement basis only. No advances will be given. Next slide, please. So now we'll go over the selection criteria for our evaluation process. Each eligible proposal will be evaluated on the strengths of the proposal and responsiveness to selection criteria. DFSS reserves the right to consult with any other city departments during the process. Successful respondents must be ready to proceed with the proposed program within a reasonable period of time upon contracting. Failure to submit a complete proposal and or respond fully to all of the requirements will cause the proposal to be deemed unresponsive and therefore subject to rejection. The Commissioner, upon review of recommended agencies, may reject, deny, or recommend agencies that have applied for grants based on previous performance and or area need. DFSS reserves the right to ensure that all mandated services are available citywide and provided in a linguistically and culturally appropriate manner. Next slide, please. The first selection criteria is the strength of the proposed program. So we ask that the respondent clearly define services to be provided directly or through partnerships, linkage agreements, that are appropriate to addressing the needs of and achieving desired outcomes for the target population. The respondent must clearly define their referral criteria for both facility-based and individual home care services. The respondent should demonstrate a clear understanding of the target population, their needs and challenges. The proposed program is supported by a strong national or local evidence base and or aligns with best practices for the relevant field. The respondent has an effective approach to recruiting, serving, and retaining caregivers, including rules and regulations that reduce barriers to participation, as well as a public health emergency policy. Next slide, please. Another selection criteria is performance management and outcomes. The respondent must demonstrate evidence of strong past performance against desired outcome goals and performance metrics and or other notable accomplishments in providing services to the target population. The respondent has the relevant systems and processes needed to track and report performance on program outcomes. The respondent has experience using data to inform and improve its services or practices, and the respondent has the relevant systems and processes needed to collect and store key participant and performance data. Next slide, please. Next is organizational capacity. The respondent has qualified staff responsible for program oversight and management. The respondent has adequate systems and processes to support monitoring program expenditures and fiscal controls. The respondent has adequate human resources capacity to hire and manage staff. The respondent has expertise working with the target population and has relevant capabilities and or infrastructure needed to serve this group. And the respondent's organization reflects and engages the diverse people of the communities that it serves. Next slide, please. Another selection criteria is reasonable costs, budget justification, and leverage of funds. So the respondent has the fiscal capability to implement the proposed program as demonstrated by an audit and or other financial documents. The respondent leverages other funds and in-kind contributions to support total program and administrative costs, including state, federal, foundation, corporate, and individual donations. The respondent demonstrates knowledge how to voucher and document expenditures, and the respondent demonstrates reasonable implementation costs and funding requests relative to its financial and human resources. The proposed budget supports the proposed scope of work or work plan. Next slide, please. So as far as the selection and transition timeline, we are doing the pre-proposal webinar today, May 27th from 2 to 4, as well as the application, which will be due on June 23rd at 12 noon. June 23rd is a Wednesday, so again at 12 noon. The contract start date will be October 1st, 2021. Next slide, please. Again, the applications are due on June 23rd, 2021 at 12 noon. At this point, I will be handing it over to my colleague Julia to speak about e-procurement and iSupplier.
Let me unmute myself. Great, thank you so much, Justina and Stacy. So my name is Julia Talbot. I'm the person who manages the RFP process for all of the RFPs that we do here at DFSS. And today I'm going to go through a little bit about how to actually make an application in the e-procurement system, which is the vehicle that we use, the online application management vehicle that we use to post our RFPs and start the procurement experience. Actually, e-procurement goes all the way from cradle to grave from a contracts perspective. So it handles our RFPs, but then also for people who are awarded contracts, the applications are then rolled up into the contracts, and that's the same system that you would use to voucher. So this could be your entry point. Can we go to the next slide? So I'm just going to talk about a little bit about how do you get started in e-procurement and do a little bit of a few tips. If you've never done business with the city, you need to register into our iSupplier e-procurement system as soon as possible. iSupplier is the system that we use to manage that people who wish to interact with e-procurement start an account in, and that allows them access to manage their business in e-procurement. So iSupplier, we use the terms interchangeably, but technically the iSupplier system is the place where you manage your account, and it allows you to interface with e-procurement, which is where the business of the city is done. So when people are starting to kind of build their RFPs and work on their application questions, I always encourage people to review the RFP narrative and application questions closely. They align with the scope and the selection criteria, and that use the information in the RFP for guidance in formulating your answers. If you are having a hard time interpreting a question or trying to figure out the direction in which you are looking for the answer to be in, like sort of how to approach it, I always tell people to read that RFP document. I understand that it's a dense document. It's not always super fun to read. It's, can be challenging, they're technical, but that in fact, we write them for a reason, and they give a lot of guidance and direction as to kind of what we're looking for. I also suggest that you carefully review the selection criteria. The way that this works is that we write the scope. From the scope, we draw out selection criteria, and then looking at the scope document and the selection criteria, we then develop our application questions, and then from the application questions and the selection criteria, we then develop our evaluation questions and our evaluation guidance on how to evaluate and ultimately rank or grade the answers that we get in the application. So it all ties together. So again, if you're having questions, you're wondering what the priority is, look at those RFP narratives, look at the selection criteria, and look how the application questions might tie into those two things, because they are all connected. When you are doing an application in the e-procurement environment, the application questions have a little text box. The text box is referred to as a quote value. In each quote value, there's a 4,000 character limit, and that includes punctuation and spaces. And so each response, so not the whole application itself, but each quote value, each answer to the question is allotted 4,000 characters. E-procurement is not going to count that for you. So I always tell people, please write your answer in some kind of word processing software that will count for you, and then cut and paste it into your answer. Additionally, when you make the application, that your application is going to be sucked away into the e-procurement system. You don't really have access to that application after you submit it to us, because it becomes our property. And so if you want to have your answers in anything besides sort of a PDF format, you really should be saving them into a Word document or some sort of word processing document. E-procurement works best with Internet Explorer. I know that this is a browser that no one really seems to use anymore. I don't use it. It works in other ones. It works in Mozilla. It works in Chrome. It works in Safari. It works in Firefox. All of those I've had no problems with, but it was built on Internet Explorer. If you are having an issue, you're getting kicked out, you're getting a lot of error messages. It's just like you're not having, like the work of dealing with e-procurement. It seems too hard. Try running it in Internet Explorer. That is the system that the platform was built to work best on. And so that is that's kind of the way to do it. The best way to do it if you're having an issue. And your final tip is do not use your back button on the browser. I use that all the time. What happens if you do that is that you won't know, the e-procurement won't tell you that anything is wrong, but it will stop saving your work. And at some point when you try to save it, you'll get an error message and get kicked out, and then you'll find that none of the work that you did since you used that button has been saved. I have been burnt on this one personally quite a few times, but you can navigate within e-procurement by clicking on sort of anything that's in blue. It tends to, that takes you to somewhere else. Just get, familiarize yourself with doing it that way and save yourself the hassle of having it kicked out on an error message. I like my personal mantra for all things RFP is start early and save often. You can, obviously you can save as often as you want. We really, our RFPs are technical. Sometimes we ask difficult questions. If you have to do anything with subcontractors or a partnership as part of your application process, that time gets eaten up. We like to have our RFPs out on the street for about 6 weeks or 45 days, and I know that means for some tight timelines. And also, if you run into questions, it's always easiest to get a hold of us earlier. We can give you better answers that time. Let's go to the next slide. Thank you. So you can submit your application and later amend it up until the due date. So that means if you are like, hey, I think I'm done, submit your application. If you are like, oh no, I forgot to do this, or I have a better answer, or the subcontractor that I was working with came in with an actual thing, not just a kind of thing, you can always amend your application up until the due date of June 23rd at 12 noon. You cannot, after that, it's gone. You can't bring it back. But when I say submit early, save often, this is what I mean. You can, if you're worried about missing the deadline, if you want to have something, as a placeholder for yourself, you can do that through an e-procurement. I do tell people to avoid the rush and possible mishaps by submitting early. So plan on your submission taking 30 to 60 minutes. And we're going to talk about the two things that we generally do. You'll need to do to submit and to accept an amendment in subsequent slides. But you really should give yourself time. Please give yourself time to do a good job, to have this be a relaxed and least stressful experience as possible. We do not accept late applications under really any circumstances at all. We actually literally cannot accept any late applications into e-procurement after the RFP has closed. The only way we can accept a late application is to rebid the entire RFP, make everybody who did make that deadline reapply, et cetera, et cetera, et cetera. So we really, really discourage thinking that is an option. I think most people have gotten the message after about 4 years, but yeah, we cannot accept applications and we will not accept applications, and we really don't want to have to repost RFPs because that's just pain. We do have a number of things to help you. You can always call me or email me. My email address and my phone number are sprinkled throughout the universe at this point. You can also make use of the e-procurement hotline for help at 312-744-HELP. They operate Monday through Friday, 9 to 5. If you there's a subsequent slide, there's like an email address that you can do that. They usually try to turn everything around in about 48 hours. I sometimes am a little bit easier to get a hold of for these kinds of questions. I don't have the same level of access to e-procurement as the helpline staff do, but I can certainly walk you through the most basic stuff or answer your administrative kinds of questions. So I think if you're having a really complex problem with e-procurement, start with the helpline. If you want to call somebody about this on a Saturday, I'm more likely to answer my phone. So next slide. So just so anybody knows, if you're a new agency, as part of your setting up the iSupplier account and making an application in e-procurement for really any contract, you're going to have the articles of incorporation, your IRS affirmation letter, your CCR number, your DUNS number. I think they're actually going to phase the DUNS number out after a while, and a certificate of good standing letter with the state of Illinois. So just so you know, have those documents scanned, ready to upload. Those are the kinds of things that we're going to be looking for. Next slide. Again, technical assistance. I talked about the helpline. If you are a person that does really well watching instructional videos or looking at endless screenshots of stuff, we have plenty of those too, under these training materials. If you're interested in looking at other kinds, seeing what other kinds of RFPs we have, I always say go to the alert section of the DFSS website. There's also a fundings opportunities section in there that has funding opportunities, so that there's plenty of ways to get help and to get technical assistance. If you want to talk to a live person, call the helpline or email. If you want to look at videos and screenshots, those are available to you too. Again, start early so that we all have an opportunity to give you the kind of support you need to make the best application possible. We hate having people kind of bounced out on a technicality because they had a hard time navigating, the actual mechanical system. So let's go to the next slide. So the two things that I'm really going to talk about for today are two very common procedures that you will probably most likely encounter as part of your application, experience with e-procurement. We do an amendment to publish the questions that were asked in this webinar and any subsequent questions that we receive. And then I'm also going to walk you through how to submit so you can see exactly how many screens you have to click. So let's go to the next slide to start with an amendment. So in this scenario, the RFP you're interested in has been an amendment. In order to start an application, you need to acknowledge and accept the amendment. And you'll see we're going to go through many, many slides. The purpose of this, as you will pick up on, is to make sure that you understand that you're going to be held responsible for whatever we say in the amendment. But you really want to read the amendment. You want to understand what you are being held to, if there are any changes. If we find a huge glaring error in the RFP and we need to change something, if we decide we have to provide more information, if we very rarely, but it has happened, we extend the due date. All of those things are going to be included in the amendment. So you want to be familiar with the amendment. This process is going to really drive home the idea that we want you, that you understand that when you acknowledge and accept the amendment, that you understand that you are being held responsible for knowing the information that is in there. I mean, there's not going to be a quiz, but you can't go back and be like, hey, this and that changed and I didn't know, because you just literally walked through 4 or 5 screens saying that you looked at the amendment. So that's what this process is about. But to kick it off, you can actually look at the amendment and read what we have to say. So you would start here. This is your kind of getting into how do I start an application. If you want to look at the amendment from the screen, you're going to view the amendment history in blue. As I mentioned, everything in procurement is highlighted in blue. That usually takes you to somewhere else. And then after that, you're going to hit this create quote because that's how you start an application. So we're going to go in with the idea that you have not, you have not started an application. So you're first going to view the amendment history, which will start the accepting process. And then if they haven't been amended yet and you just want to start an application, you hit create quote and hit go. So let's pretend we're going to view the amendment history. So let's go to the next slide and see where that takes us. So to begin the acceptance and acknowledgement process, you are going to look at the review changes. If you want to click and see the RFP in view only, you can click on the document number, which is the RFP number, and that will show you the that will show you where that will show you the RFP and everything. If you want to look at and then if you wish to understand what you are acknowledging and accepting, you hit the little eyeglass thing and review changes. That's going to be the amendment document. You'll see in the middle here, the amendment description tells you, it's like a little one sentence that says what is in the amendment, just highlights like this is from the webinar, or hey, we're changing the date. After you have done these things, you're going to acknowledge the amendment by hitting the button on the lower or upper right-hand side that says acknowledge amendments, and that will take you to this next slide, where you have to click this little tiny box saying that you accept the terms and conditions of the RFQ and also acknowledge the changes made in the RFQ amendment document. And then you're going to hit acknowledge on the upper right-hand side, and that will take you to this next slide. In this next slide, it's going to be a confirmation of the fact that you have acknowledged that you confirm that you acknowledge the amendment, and then you're going to hit yes on the sort of middle right-hand side, and that will take you to the next slide, where you then confirm your acknowledgement, and then it asks you, do you wish to proceed? So you've confirmed your acknowledgement many times. That will take you to the next slide where you wish to proceed. And then, because you can't think that you accepted this thing so many times, then you finally do the check box down at the bottom of the left-hand side that you have read and accepted the terms and conditions. The terms and conditions are written in that tiny font right above about the city makes no representation or guarantees that the electronic procurement system utilized by the city on any procurement will accurately and timely transmit the bidder's bid. Basically, it's sort of a lot of legalese. All bidders use the system at their own risk. I don't really understand why they're putting that in there. That seems kind of mean. But anyway, you check this little tiny box on the lower left-hand side, and then you're going to hit the accept button on the right-hand side. And that will bring you to the end, I believe. Let's go to the next slide. And yes, then you are done. So that is how to accept an amendment. Super painful, but it only takes 7 clicks. And I like to think that the information that we include in the amendments are helpful. How to submit an application. So this is, you will see, it's less painful than the amendment process, in my opinion, but at the same time, it's not just a click send and say goodbye and then go on your merry way. Of course not. We're the government. So next slide. So when you are ready to submit, you start by saving your draft one last time, and then you click continue. So you see here in the upper right-hand side, there's the save draft. When you hit continue, that's gonna, when you hit this continue thing, it's gonna put you it's gonna review basically your whole, all your work, and allow you to then proceed with the submission process. So let's go, you save your draft because, hey, save early, save often. And after you hit continue, it basically scans the whole document and then finds errors. And an error isn't really an error, it's just where e-procurement thinks that maybe you were supposed to have done something that it doesn't feel that you did. We're gonna go through 2 very common errors in here. It's not uncommon when you hit that continue and it does the scan to get like 4 or 5, and that's what eats up the time. That's why it's not just a press send and go, because you have to go through each error, correct what the system thinks is the matter, and then do the continue, resubmit, continue, resave, continue. So in this particular case, this is a very common error. It says you must quote on each one line in the RFQ. Let's go to the next slide, where I have that in slightly bigger font. You'll notice the error message is usually direct to something left undone in the application. In this particular case, the error message indicates that the lines have not been filled out. So in here, you'll look right down below this error message. It says there's a little tab that says lines. You click on that and you fill out the lines. In this case, we require that a budget be uploaded as in an Excel spreadsheet, and that's what we use to review. E-procurement has a system that allows you to that tracks the your budget in the lines, the lines page of this, but we don't use that to evaluate your RFP. It would like you to have placeholder numbers in those lines. We don't use those. You can put whatever number you want. You can put ones. It has to be a number. It can't be a 0, but put 1, put 1,000, put your favorite number, put pi, whatever you want in there, or put in your proposed budget numbers. But we don't really look at that as part of the evaluation. We don't look at that at all as part of the evaluation. And so, just as long as you fill something out, if you get this message here in good shape as far as we're concerned. Let's go to the next slide. Here is another common error. It says a quote value is required for the requirement first name. As I was saying about this, the 4,000 character limit, all of our answers those text boxes are referred to as quote values. The requirement, which is e-procurement ease for the question, would be the requirement named first name. And it says here, that it says here first name. And so you basically, if you get the quote value is required, it means you forgot to answer a question. In this case, you would just go into the requirements section, you'd find the one that's labeled first name, you put in the answer and save and go on your merry way. Let's go to the next slide. So after you've done all of this and you keep doing that continue button and get the scans, and you are ready, or you're free from errors, you're ready to proceed and submit. So at this point, when you're error free, when you click the submit button instead of getting or the continue button instead of getting errors, you're going to get this review, and you're going to have the create quote goes into the review and submit phase. And that is now going to give you the opportunity to review all of your work. You'll see here, there's a printable view. Remember how I said when you make the application, it kind of sucks your application away, you can't see it again. So you want to do this printable view that's going to give you a PDF version of what you've submitted. And so that then you'll see exactly what you said to us before it gets sucked away and you can't see it anymore. So let's go to the next slide. In the printable view, you're basically going to be able to review all the data and confirm that's correct. You're going to be able to see where, make sure that your attachments are correct. You're going to scroll to, go through the whole thing, and it's set up as one really long page. So you just keep scrolling. So we're going to go to the next slide and see what you'll see here. It says all this stuff. If you scroll all the way down, you get to this point where you're going to do an electronic signature. You're going to put in your name and your title, and then you're going to click the box last. If you click it before, like I do, or tend to, because it's the first thing, and then put in your name and your title, you'll get an error message, which is just one more thing you then have to go and correct. So you're going to, you do the signing, and then let's go to the next slide. After you've done your electronic signature, you can submit. It's actually, I couldn't put that screenshot on one thing and have it still be legible. So it's the same screen. You just need to go over a little bit more, and you have your submit button. You're going to press submit, and let's go to the next slide. And then you're going to get this confirmation. So the e-procurement, this is your submittal confirmation screen. If you do not see this, you have not submitted. The e-procurement system is going to send you a confirmation email within 24 hours to the email listed in the application itself. But if you want to know prior, just give me a call or drop me an email, and I am always happy to confirm that you've gotten your application if you want to have a more immediate experience than waiting for the email to show up. Yeah, that's not a problem. But if you see that confirmation screen, you know that you're good. And that would conclude how to make, how to do your submission. So you can see it's not just a press and go and be happy kind of experience. It's more like a press and go and save and then continue. It's going to take you more than a minute to get this thing submitted properly. That's all I have to say about e-procurement. Let's open this up to questions for both e-procurement stuff, but also any programmatic questions that you might have. That is what we're here for, and I can't thank you guys enough for spending the hour with us to learn about this opportunity. So I'm gonna turn it back to Stacy and Jatina as well. Let's see if there are any questions. So all raise your hand at once. Mm-hmm. Interesting. So, Stacy or Jatina, is there anything that you would like to share?
Well, we do have our contact information listed there on the slides, and so if there are additional questions that come up, after this presentation, please feel free to reach out to us, and we can include that on our amendment.
Great.
Okay, thank you, Julia, for walking us through e-procurement. If there's no other questions.
Yeah, if there are in fact no questions, then I think we'll like maybe give it another minute or two, and then best of luck. We are really looking forward to seeing all of your applications. If you do have questions, subsequent questions after looking at this RFP more carefully, don't hesitate to email or call out. Call us. It's what we're here for. And then, yeah, other than that, have a wonderful afternoon.
Thank you, everyone, for joining us today.
Okay.
Thank you, everyone.